Sunshine though. Need your sunglasses, which is nice. We haven't had a couple of days like that in a row. We get rain back in the forecast coming tomorrow. Alex Munter joining us, President and CEO of CHEO. Great to have you here.
Thank you.
We saw each other in passing yesterday at the telethon.
You were part of the army of people making that telethon
and
work.
There was an army of people and volunteers making it work, but a community that responded with $6.7 million.
It's a record. Best ever result for the telethon. And you know, one of the things we say about CHEO is that CHEO is small enough to care, but big enough to make a difference. And you know, last night I was feeling that about our community, about our region. Small enough to care, but big enough to make a difference, because that $6.7 million in terms of funding research, programs, equipment, services, that will make a big difference for kids and families.
The families and the children were amazing to hear their stories, and there are so many stories that come out of CHEO, but with that comes new projects, new endeavors, and that is really where this money is going to be kind of filtered through. So for people who are looking towards the future, what's in store now for CHEO?
So we've developed a plan for the hospital going forward. There's a lot of change coming in our community. One of the things I'm not sure people know is that, in fact, the child and youth population is growing. We talk a lot about an aging society, but in fact, there's going to be more kids. So demand for CHEO services is going to increase. And so we've charted a vision for the future. Our plan is, of course, that CHEO's care will change young lives in our community, and CHEO's innovation will change young lives around the world. And so looking at how we can deliver an exceptional patient experience, how can we do a better job connecting care, driving evidence into every improvement, and the resources that the community every year through the telethon, and you know, there's 250 events a year for CHEO in this region.
Well,
you would
that
know,
was what I really,
them, right?
I realized that, especially too with the presentations, as you learn. I mean, 250 of those to come through and to talk about their events over the telethon. The one thing I know as a parent, and I know I have the opportunity, I'm lucky to interview so many people here on the couch, was the CHEOnext programs, that these seminars that are offered, and you know, you've got healthcare professionals and doctors and people on board with parents. Are these the similar types of programs too that are still in development, that are still being incorporated? And
we're continuing on with CHEOnext, but one of the big pillars going forward is something we call connected care. And that means going out into the community to share the expertise, but it also means making our people and our services and our information available online, so people don't necessarily have to come to the hospital. It means working with other organizations. So a lot of the CHEOnext sessions, as you know, have been about mental health, and we've recently launched a new program, CHEO, the Royal Youth Services Bureau and Ottawa Public Health, for youth who've been inpatient mental health, who've been discharged, and to help send them on the road to recovery, and so they don't have to come back to the hospital.
It was something that between all of the hospitals and with YSB that you realized that there was a need once they were discharged, where do they go?
Where do they go,
so
right?
that is a big aspect to what everyone's been working together for.
It's a good example, and it's the way of the future for us. So because the way the healthcare system is organized is around the services of organizations or the skills and expertise of professionals, and then we ask people to go and find what they need. But if what you need is complicated, or if you are in crisis, so kids and families dealing with mental health are often in crisis situations, trying to figure out how a complicated system works doesn't work for you. And so the idea is for all of these different organizations with a lot of skill and a lot of people to come together and go meet the family, as opposed to the other way around. And so we're doing that in mental health. We're doing it as well with complex care. So we've got a project for kids who have very complex medical needs that's been very successful in reducing the number of times they need to come to the emergency department, the number of times that they need to be hospitalized, and increasing the number of times their own physician in the community can help them, which is always better if we can make that happen. So the CHEOnext sessions, using technology, our goal in a few years is that a parent can log on and see their child's health information online.
You know, you're not asking those questions. Wow.
Make an appointment online, right? So the rest of the world does this, right?
The little things, but you need to get there.
And really, our focus, you know, everybody knows the folks at CHEO, caring, compassionate, skilled, quality care. and we want to make sure we deliver an exceptional patient experience.
Well, I think the community responded yesterday and over the weekend, knowing that that's needed, $6.7+ million raised, and great to hear about some of these programs that are going to be incorporated as
People
well.
can check it out at CHEOnext.com.
Perfect. All of the information listed on your screen, CHEOnext.com, to head to that website and check out all the programs. Thank you so much.
Great to
and
see you again.
congratulations once again.